Hi all, I am Dr. Pradesh. Today we will discuss about epilepsy. We will see some basic facts about epilepsy and also some few things which the epilepsy patient should be taking care of. First of all, what is epilepsy? In ancient times, people believed that epilepsy is produced due to influence of some spirit and all. But now, with the evidence of scientific studies, it is proven that epilepsy is caused due to abnormal electrical activity that is happening inside the brain. Now we will see what are the causes of epilepsy. If we take each age group, there are numerous causes for epilepsy, starting from childhood to elderly people. So, for example, if you may say, if you take a newborn age group, if there is some deficiency of oxygen reaching inside the brain at the time of birth, after a few days, such a baby may develop epilepsy. And also there are febrile seizures in childhood. That means child develops seizures when he develops fever. And also there are different kind of genetic epilepsies, that is hereditary kind of epilepsy, and different acquired conditions like tumors inside the brain, and also some trauma happening to brain, infections, and there are such numerous causes which may produce epilepsies. So, what all are the symptoms of epilepsy? Uh, we are more familiar about that generalized seizures with the shivering of both upper limb and lower limb, and patient becoming unconscious. Uh, but there are some other types of epilepsies also. With the patients may present with repeated startling kind of jerky movements, and patient may suddenly lose awareness with the surroundings, and people may suddenly lose the ability to speak or ability to understand, and there may be recurrent drop attack. People may just fall down. So such there are different kinds of epilepsies. Next is what all are the main investigations done for epilepsy patients. One is a test called EEG, which is done to detect abnormal electric discharges inside the brain. So second is scanning. Usually MRI scan is done preferably, or at least a CT scan of the brain is done. And depending upon case to case basis, sometimes newer modalities like functional MRI are also done. Next is about treatment of epilepsy. So it can be divided into two: treatment of acute attack and long-term treatment. About acute attack, what you have to understand is when a patient suddenly develops symptoms of a sudden attack of epilepsy, he should be made lay down, and we have to remove sharp object if some anything is there in his body or nearby area, because of vigorous shaking he may get injured because of that. If he is wearing spectacles, it should be removed, and he should be kept in lateral position so that this froth and oral discharges, it will be drained out and it will not enter into lungs. And nowadays, for patients who has got uncontrolled epilepsy, recurrent episodes of epilepsy, there is one, and nasal sprays are available like midazolam nasal spray, which can be applied to control the seizures rapidly, and he has to be taken for medical care immediately after that. Next is about long-term treatment of epilepsy. The most important thing is about the epilepsy medications itself. So it has to be taken in uh, prescribed dose, in prescribed timing, and in the prescribed for a prescribed duration. And we have to continue the follow-up as the doctor has advised. And there are also some restrictions for epilepsy patients. And one important thing is about sleep, and we have to avoid sleep deprivation. Minimum 8 hours of sleep should be there, and if there is some problem with nighttime sleep, we have to compensate in the daytime. And we have to avoid flashes of light, whether it is in mobile or it is from screen. We have to avoid it directly coming to our eyes, and we have to avoid some dangerous situations like swimming and climbing into heights, etc., until the epilepsy is completely controlled. Next is about driving. In a patient with uncontrolled epilepsy, driving is prohibited. Once that epilepsy is controlled with medications, whether we can drive or not, that depends upon motor vehicle act of different countries. In some countries, after that epilepsy is controlled, we can drive after 6 months. In some countries it is after 1 year, and in some countries even it is after 3 years. That depends upon laws of different countries. A lot of concerns epilepsy patients used to express. One is whether it is a curable condition once the treatment is started. Sometimes whether they have to continue this treatment lifelong, whether this drugs has got side effects. So what I have to say as a neurologist is epilepsy can be life threatening. So above all discomforts, our prime aim should be to control epilepsy. So rather than ignoring or neglecting this epilepsy, we have to learn to adjust with this condition and proceed. We will see in next video. Bye.